as the global race is on to vaccinate people against COVID-19 and with infections soaring worldwide. Well, with a recent imitated version in South Africa, many have complained about how slow the vaccination process has been. But what do Ghanaians know about COVID-19 vaccines and how important is it to get vaccinated? Well, GH1 News' Edem Farrie has more in the following report.
Currently, about 55,772 cases have been recorded, with some 54,438 recovered cases and 336 deaths. You would think Ghana will not need the COVID-19 vaccines, but with the mutating nature of the COVID-19 virus, world leaders are pushing for blanket immunization instead of only targeting those at risk and infected groups. With vaccines at hand, you are likely restricted from traveling without being vaccinated. The question, however, is how important is it to be vaccinated? Dr. Brevetti and Dr. Thompson, both medical doctors and frontline health workers in the US, have this to say.
So looking at the two vaccines now, we would like to know what makes the two of them special.
So the two vaccines that you mentioned, and I think there's some variability depending on what part of the world you're in. Here in the United States, the first vaccine that became available was Pfizer, followed by Moderna. It appears that in Ghana, it's Pfizer followed by the Oxford vaccine.
Yes.
The Pfizer and I believe the Moderna are similar in that they use a piece of mRNA that is delivered through injection, and the body forms an antibody response to that. The Oxford vaccine is slightly different in that it is a message that is intended to stimulate an immune response, but that is delivered via a inactivated virus.
Vaccines are used to prevent infection. Mm-hmm. So vaccines are not used to treat people who are currently infected. That's number one.
Okay, what about those who are infected now?
So there's other medications that are used to treat an active infection, but the vaccine is not used to treat an active infection. An active infection is treated with things such as remdesivir that has been out in the news. Also, antibodies from other people who have already had the disease. I'll ask you this question, Edem. Would you rather have a disease and go through the complications of that disease and then get immunity? Or would you rather take a medication that will prevent you from getting that disease altogether so that you'll never have to worry about it? So to answer your question, we're asking that everyone get vaccinated so that, number one, we can prevent you from getting the disease and prevent you from the sequela of getting the COVID-19 disease, but also to help eradicate globally this pandemic that has arisen from infection with SARS-CoV-2. What did I go through before getting the vaccine? Not much at all. The only thing that I did go through, and I think everyone goes through this, mentally, I was thinking about, okay, here I am. I'm going to be the first in the first group of people who are receiving this vaccine. And the vaccine was created very fast compared to other vaccines.
Yes.
And there's still a lot of information that we do not know about SARS-CoV-2.
Yes.
But mentally, what I was going through was trusting my training, trusting the science, listening to my other colleagues who are experts in this field, and
yes,
relying on them.
Second, would you need another vaccination maybe in 2 years or 3 years or 4 years to come?
So the current program, each of the vaccines, and there are others that are becoming available in the months ahead from different laboratories around the world. The current ones are a 2-injection regimen, approximately 3 weeks apart. There's a better response rate in forming antibodies after the second injection. The response rate of the two that are available in the United States is around 95%. So that's an excellent response rate. That's better than we probably would have hoped for. What we don't know is if the vaccine will have the same level of antibody formation. So at the very least, it's it's gone through the trials, went through phase 3 trials that were tens of thousands of people, both for safety and for efficacy. There is an antibody response. We're not 100% sure how long that's going to last.
Is there some foreseeable side effects in the near future?
Yeah. So, Edem, that's a good question. And the honest answer to that question is that we do not know. We do know short-term side effects. The studies on the Pfizer vaccine and the Moderna vaccines here in this country only took place for approximately 5 to 6 months. So time will tell if there are longer lasting or other side effects that happen in the future.
Okay, so I'm not saying this should happen, but in case in case of death, whilst being given the vaccine or whilst on the vaccination, who is accountable for that? Who is going to be held accountable?
That's a loaded question, Edem. You first have to determine what is the cause of death. Just because someone had a vaccine and then passed away does not mean that the vaccine caused the passing of that patient.
The vaccine is protective, but not some patients who get the vaccine will not form a antibody response and might be susceptible to COVID. It's just that in most people, they form a protective reaction to it. I know here in the United States, there are some governmental entities and laws. I don't know what they are, but I know your question is not the first time that question has come up. So at the governmental level, there is a process or a board or a compensation pathway. But as Charles said, people get sick all the time without vaccines of things that are unrelated. What we do know is the vaccine has been administered now, I guess, in the millions. Right? We went very quickly from the tens of thousands into the millions. We've been injecting here for 3 weeks in the United States. There's not, my arm was a little bit sore after I got, injected for a day or so, but I felt fine. I felt great from a psychological standpoint because I couldn't wait to get the vaccine and at least, give myself a chance to generate some immunity. But we know that COVID is a really bad actor. So I think some theoretical, again, as Charles said, anything is possible. We really don't know. Yes. But many of these techniques for this vaccine have been used for some time. It's just that this one was fast-tracked.
Okay. All right, let's come back to how possible it is for the vaccine to have a tracker.
This is somewhat outside of my area of expertise. And so the opinion I'm going to share with you is exactly that, mine alone, my opinion alone. The answer to that question, I think, is no. The vaccine does not have the ability to have a tracking, what some would refer to as nanotechnology, to have trackers in them to track people.
I would encourage anyone who's not comfortable to speak either to their physicians or their community leaders to help them with the decision making. Now, that doesn't mean they're always going to get, the answer that I would agree with, but I think the odds would be more in their favor than some of the misinformation that you get from television or the internet. The internet's a great source of information, but there's a lot of misinformation on it.
What I would say to people who are concerned about receiving a vaccination is that your concerns are normal. You're supposed to be concerned about receiving not only vaccinations, but any other kinds of medication.
Let's have a look at what people think of the vaccines on the streets of Accra.
Side effect government don't fight the bonim bre. I say omuna